asking for some votes on some minutes and just making sure everyone is welcomed and able to share their thoughts and information today. And we could probably navigate to the next slide if that's all right. And you can go to the next one after that. Thank you, though. So we just want everyone to remember that this meeting is open to the public and welcomes public testimony. The meeting will be recorded and live transcription is available. And if you're able to, and in a safe space to do so, feel free to turn your camera on. And also a quick reminder to those that are members of the Healthcare Workforce Committee, if you are able to, please update your name to reflect CM so that we can identify everyone that's here. And we could navigate to the next slide, please. Okay, this is where Ian usually does a roll call so that we can know who's here today. And so I'm just going to go down the list as it was presented to me. And we'll start with Stephanie Grayson. And we'll go next to Rosemary Hemmings. And next is Laura Chan.
Present.
Thank you. Next is Gretchen Horton Dunbar. Next is Megan Holland.
Present.
Thank you. Next is Surya Karlapati. Next is Alicia Jackson.
Present.
Thank you. Next is Tessa Christensen.
Present.
Thank you. And Kelly McKnight. Molly Reynolds.
Present.
Thank you. Rob Ross. Elena Skoblaski.
I'm here.
Thank you. And next is Koi Vu. Next is Eric M. Weiser.
Yeah, I'm here.
Thank you. And Judy Geiger. Next is Manu Tardri. Next is Robert Lieberman. And Jason Johnson.
Present.
Thank you. And next is Larissa Mejia Medina. And next is Melina Moran.
Present.
Wonderful, thank you. And we'd also, just like any OHA staff and any guests on the call, to feel free to introduce yourselves in the chat. And if we could go to the next slide. And thank you so much. These are the OHA staff attending today or hoping that they could be here today. And next slide. Okay, just wanting to showcase the agenda today. We're in the process of convening and we'll next review and approve, hopefully, the draft of the September meeting summary. And then we'll move into public comment period. And then we'll share in some Oregon Health Policy Board and Oregon Health Authority updates. And then we'll discuss the Healthcare Workforce Committee membership. As time allows, we'll have a break. Then we'll move into learning information about planning for healthcare workforce needs assessment for 2027. Then we'll review next steps and adjourn. Okay, before we jump into the review of health equity, oh no, excuse me, we do need to review this first. Thank you so much. So if we could move to the next slide, please. So we just wanted to review that the health equity definition for the Oregon Health Authority and the Oregon Health Policy Board is Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and temporary injustices. And thank you so much. These are the guiding questions for our equity framework, and we normally don't read through all of them, but I would encourage everyone to take time to review them as the slides have been shared and will be reshared just as a follow-up. Okay, and then previously, the September meeting summary minutes were emailed out and thank you, there's a link in the chat for also further review. If we could have a motion to approve and then a vote on approval.
I'll make the motion.
Thank you. And do we have a second?
I'll second.
Thank you so much. We will consider the September meeting summary minutes approved. And if we could navigate to the next slide, we'll move into an opportunity for public comment. And so if there are any...
Hello. I'm sorry. Don't you
Oh,
have
yeah.
to actually call for a vote?
Oh, I'm so
It
sorry.
was first and second, and then you ask for a vote.
Yes, let's do that. Thank you so much. Let me bring the roll call up again. Thank you so much. All right, and I'll go through the same list just in case there are folks that have meandered into the meeting. Stephanie Grayson, Rosemary Hemmings, Laura Chan.
I'm here, and it's Dr. Hemmings, okay?
Oh, I apologize. Thank you. Laura Chan,
I'm here.
and would you like to vote yes on the approval?
Oh, I'm a non-voting member.
Oh, thank you so much. And Gretchen Horton Dunbar, Megan Holland,
I vote yes.
thank you. Surya Karlapati, Alicia Jackson,
Vote yes.
thank you. Tessa Christensen,
I vote yes.
thank you. Kelly McKnight, Molly Reynolds,
I vote yes.
thank you. Rob Ross,
I'm here. I'll vote yes.
thank you. Elena Skoblaski,
Yes.
thank you. Koi Vu,
I vote yes.
thank you. Eric M. Weiser,
Approve.
thank you. Judy Geiger, Manu Chaudhry, Robert Lieberman, Jason Johnson,
Approve.
Thank you. Larissa Mejia Medina and Melina Moran.
I'm a non-voting member.
Oh, thank you so much.
Mhm.
And I'm going to defer to my colleagues who helped organize the meeting today. Does that suffice the needs for a vote of approval?
Yes, it does. The September meeting minutes are approved.
Thank you so much. Thank you all so much for your patience. Okay, and we'd like to move into the public comment piece of the meeting today. And so if there are those in the call today that would like to share their comments, please feel free to raise hand so that we share space, and then we'd love to hear from you.
And Jordan, has anyone requested to provide public comment through email or other channels to you?
I have not received anything for public comment today.
Okay, then we'll just give people a minute on the call if anyone wants to provide it.
Okay. Not hearing any, we'll move into the Oregon Health Policy Board and Oregon Health Authority updates.
All right. Thank you, Levi. My name is Melina Moran. I use she, her pronouns. I am the liaison from the Oregon Health Policy Board to this committee. Yesterday we had our board meeting, and I am here to give you an overview of that meeting. I want to remind everyone that anyone could attend that meeting. And our next meeting is December 9th, and it's a hybrid meeting, and that will be held online and then also in Portland in the state building. Um, so we welcome two new members, Hayden Rookley and Aaron Hines. And we also have one vacant seat to be on the board. You could apply for that online through Workday. Next, we had a behavioral health division update regarding metrics. This update included what they've been working on through this past year and how they've been developing their strategic plan. They've come up with 5 strategies with each strategy has different outcome measures, and each outcome measure has different strategies and different process measures. And these strategies will be shared with the board at upcoming meetings, the specific strategies. And we also heard from the Behavioral Health Committee, who helps develop the quality metrics. And they give us an overview of their work from 2025, and they assisted in developing these strategies. All of this information will go on the behavioral health dashboard in the first quarter of next year. And this was regarding the administrative costs. So in the September meeting, the board approved the budget, except approved to keep the administrative costs the same. And asked the program to go into and have a deeper dive into the increase. And so the Healthcare Provider Incentive Program group did a wonderful job. They did a deep dive and they presented more information on the reason behind the administrative cost. And they did a cost modeling per recipient. Remember this healthcare provider incentive program. Thank you for putting those slides in the chat. This includes, and not limited to, loan repayment and forgiveness. Also, tax tax credits, and a number of other programs. So the board voted and approved the revised administrative cost. Next, we had public comment, and I encourage you all to listen to the comments. There was also some written comments that were sent in. A big part of our conversation was from the OHA updates, conversations and collaborations, and Claire Pierce-Werble was there to give us an overview. She touched on three major points. One was the federal response from the OHA, the federal shutdown, and coverage for Medicaid. So, regards to the federal response, there is a dashboard that the OHA has, and this is the best way for the public to get information. OHA has partnered with ODHS and to create this dashboard, and they're following closely the federal response and how it affects any Oregonians in regards to access to healthcare coverage and any HR1 changes that will affect Oregonians. Next, the federal shutdown. So open enrollment is currently open. The marketplace has seen increase in premiums, and that, as you know, can be a daily changing environment, which is being monitored closely. Currently, OHP is not affected in any coverage or access. And the USDA has provided funds for WIC, women and children, and so there will be no loss in coverage and funding for them. Currently in Oregon, we have 1.4 million people who rely on OHP, and OHA will work to keep people covered and also to comply with the federal mandates. So currently, some of these are eligibility checks. So one of these, an example of this is that people on OHP will have to go through eligibility checks every 6 months, which means that there will be additional paperwork and forms that they will have to fill out and keep up on to keep their OHP current. And OHA plans to make this as painless and easy and streamlined as possible. Like I said, this will happen every 6 months. There'll also be work requirements. Both of these will not go into effect until 2027. Also, just an update, the Healthier Oregon program. This is the healthcare for the immigrant communities. There is no changes and it is fully funded. So with the federal cuts, OHA budget needs to be reduced and balanced, and they have been asked by the governor's office to create a budget list and bring that back to the governor's office. She did stress that no decisions have been made. This is just a list, and it will be presented at the next legislative hearing coming up. So that was a lot. And again, she directed regarding the federal response, that dashboard is the most helpful place to find up-to-date information. Next, we heard from two of our board members regarding the draft. They presented draft and guiding principles on a new subcommittee, the affordability subcommittee. They presented some values and principles for this subcommittee, and these values and principles centered on patients and the families. Also wanted to focus on equity and a good for the public, good for all. I also wanted to have purchaser perspective and make sure that this was evidence, the decisions were based in evidence-based decision making. I wanted to simplify administrative efficiency. And then they wanted to focus their direction on systemic solutions and how care was delivered. And also wanted to have not only short-term solutions, but also to develop long-term solutions. So this draft was voted on by the board and adopted. And finally, we heard from a small work group that is working on to develop a primary care integration subcommittee. The goal of this subcommittee is to align all the work that is happening in Oregon in primary care. And a charter will be presented to the board at the December meeting with plans for a quick recruitment and membership recruitment. And yeah, so again, I encourage you all to attend that December 9th meeting. And it will be hybrid and online and in the state building in Portland. And with that, anyone have any questions?
Well,
Thank you.
thank you so much, Melina. And I'll turn it over to Deep D to learn about the written updates for OHA.
Sure. The written updates were included in your meeting materials, and I also posted a link to those. Related to that, we do have a verbal update from OHA about the Healthcare Provider Incentive Program and the budget allocation presentation, and that will be given by Neelam.
Hi, everyone. Neelam Gupta, she, her pronouns. I'm the Director of Clinical Supports Integration and Workforce here at the Oregon Health Authority. And as you heard Melina report, the Healthcare Provider Incentive Program provided a presentation at yesterday's OHPB meeting based on the committee's approval of the budget allocation in August. We presented at the September meeting for OHPB approval. And again, as Melina mentioned, the incentives portion of the budget was approved, as well as the 2023-25 administrative costs allocation at that level. And we were asked to provide additional information on cost modeling prior to full approval of the administrative budget. I want to thank Melina so much for her amazing support, as well as the program staff, Jill Boyd and Alyssa Sloan, who prepared wonderful information for yesterday's meeting, and we were successful in getting approval. I will share those slides in the chat for anyone who's interested in seeing the details of the cost modeling information we provided.
That's great. Thank you.
Wonderful. Thank you all so much for those updates. We're going to move now to hear about the Healthcare Workforce Committee membership update.
Great. So as you all know, we did a recruitment process for the Healthcare Workforce Committee earlier this fall. And so I'm just going to be going over that process a little, going over the new members that we're hoping to have added to the committee. And then at the end of the presentation, we wanted to leave some space and some time to hear from the members that are going to be leaving the committee in 2025, and also give an opportunity for any members that just want to say anything or just want to share any memories that they might have or anything else. Unfortunately, Ian, our chair, was not able to join us today. I think he would have really enjoyed this part and would have liked to send committee members that are leaving, a good farewell and a very hearty thank you. But the process that we used was actually very similar to the process that we used last year because we follow the Oregon Health Policy Board Committee recruitment guidelines. There are 10 committees under the board, and so it really helps if those committees use a consistent recruitment process as much as possible. So we developed that recruitment notice both in English and Spanish, and we posted it for about a 5-week period. In the meantime, we did a lot of work behind the scenes to get the recruitment announcement sent through 2 different groups and have them advertise it through, their listservs or those kind of channels. And then we also asked committee members to get in touch with people that they thought might be a good fit for the committee. We had some members and also some past members that took it upon themselves to do that, and we really appreciate that. We developed a review committee that had OHA staff and then our chair who reviewed the applications. We invited the applicants to do a group interview, and we also asked them to complete a survey with information that had more details about the time commitment and sort of the requirements for becoming a committee member. We ended up doing 2 sets of interviews, one for non-student members that would serve a 3-year term, and then a second set for student members that are non-voting and serve a 1-year term. We ended up doing a total of 20 interviews. Those were done in a group setting, so we had, up to 3 people in one interview doing it at the same time to save a little bit of time there. We completed those interviews. We did a Oregon Health Policy Board gap analysis. We used their tool to identify some gaps that resulted from members who are leaving the committee so that the recruitment process could address those gaps. We were especially looking for candidates that had experience working with CCOs, working in tribal health, academic and educational organizations, with Medicaid and OHP. And we were also looking for candidates who were part of the traditional healthcare workforce, nursing, oral health, and pediatric and maternal health. We were also looking to expand our geographic diversity, especially in the areas of Southern Oregon, Eastern Oregon, and coastal areas. And we were also looking specifically for candidates who had experience either working in or living in rural areas. So the candidates that we selected in this review committee, we will propose as a committee slate to the Oregon Health Policy Board at their December meeting. And it will be Ian, our chair, and myself who will be doing that presentation to the Health Policy Board next month. Next slide, please. So these are the members that either have left the committee or will be leaving the committee at the end of the year. And it's a combination of 3 of the members. They have served their second 3-year term, so they can no longer be on the committee. And then other members have had to leave for different reasons. Melina mentioned that Aaron is now on the Oregon Health Policy Board. Other members had retirement or job changes that sort of changed what they wanted to do. And at the end of presentation, we'll give people a chance if they want to say a few words. If not, that's totally fine too. Next slide, please. Great. So this slide has everyone that's remaining on the committee. I'm not gonna read everyone's name. And then we also had 2 members that were reappointed for their second term. That was Dr. Rosemary Hemmings and Laura Chan, who's our student member. Dr. Hemmings will start her second term, and Laura will also start her second term, although the student terms are just 1 year long. Next slide, please. So we had a really wonderful round of candidates that applied for the committee this time around. Our original goal was to pick between 6 and 8 candidates to join the committee, but the choices were so wonderful. We actually are proposing to add 9 committee members to the committee in 2026. We had a great turnout in terms of the specific areas of expertise that we wanted to hit, and also in terms of geographic diversity. And so these are the members that we're hoping to add to the committee. I will just read what it says there about them. Andrea Brown, who's a traditional health worker liaison for Umpqua Health Alliance and who lives in Southern Oregon. Regina Castellone, the Director of Diversity, Equity, and Inclusion for All Care Health, also from Southern Oregon. We have Sophia Aiello, the Quality Metrics Specialist who works with Eastern Oregon CCO. Amberina Fairley, who's a dentist and is the president-elect for the Oregon Dental Association, and she resides in Bend. We have Virginia Chambers, who's the Director of Health Sciences at Clackamas Community College from the Portland metro area. We have Patty Barfield, who's the Assistant Dean and also a nurse from the OHSU School of Nursing, who lives out in Eastern Oregon. We have Krista Lavas, the Senior Director of Provider and Community Relations from the WVP Health Authority, who lives in Marion Polk area. And we have Rebecca Descombs, who's a tribal health policy contractor from the Portland metro area. We also had a great turnout. Thank you, Laura, for pushing this in the student community. And we picked a student voting member to join the committee, hopefully. And her name is Chancella Kalabi, and she's a medical student at OHSU and currently lives in the Portland metro area. And so those are the people that we have that we're hoping to present to the Oregon Health Policy Board and invite to join the committee in January of 2026. Also in January, we'll be having a orientation for the new members where we orient them more to the committee work and about the different partners that you work with in this role. Does anyone have any questions about the recruitment process or about any of the... Yes, go ahead, Dr. Hemmings.
Yes, hi. Thank you for presenting the list. And anyone who's known me probably know what I'm going to say or I'm going to ask. I'm happy to see that, there's a traditional health worker listed on here. However, it's still very heavy on the top of the food chain in organizations. And I was just wondering, in terms of the totality of the applicants, did the list of applicants primarily represent those who are in leadership roles within the healthcare organizations? Is that what you found?
Yeah, so one thing I wanted to mention is we actually extended an opportunity to interview for every single applicant that applied. And so we didn't go through a screening process and rule out anybody. We gave everybody the opportunity to apply. But to answer your question, we have found with recruitment that there are more people in leadership positions that do tend to apply. I do think that this group is heavy on that part where it's leadership, but we do have a few people like Sophia. She's a quality metrics specialist. and also Rebecca Descombs, who's a policy contractor, who I would say are not in leadership positions, at least yet.
Okay. Thank you for providing that additional information. My other question is the current student who's currently on the committee, isn't that student also from OHSU?
She is. She is. Actually, all of the applicants for the student role were all from OHSU. And so I think um, for future processes, we have to figure out a way to widen that and get the word out in other ways. I mean, the recruitment announcement was publicly posted, but I think it is heavy on the OHSU side.
Yeah, I think there needs to be some intentionality around actually reaching out to other universities within, the state of Oregon. And I would hope that we could actually make a note of that so that the next time there is an opening, we're not having this same discussion around OHSU being the university of choice as to where we get our student committee member.
Absolutely.
Thank you.
Did anyone else have any questions about the recruitment process or the folks that were proposing to join the committee? Okay, I'm not seeing any.
Just a quick question about the non-voting members. So is it non-voting members or students? Or what differentiates
Yes.
between a non-voting member and a voting member?
Yes, the non-voting members are all, they're a student role and they serve a 1-year commitment rather than the 3-year commitment. And then they can stay on for a second year. And right now we have one person in this role, and that's Laura Chan. And she will be joining the committee or rejoining the committee again for next year. And then we'll have an additional student join.
Great, thank you.
Oh, yes, go ahead. Go ahead, Bob.
Hi, I'm just joining for this part. I'm at a healthcare forum down here in Ashland, attended by Governor Kitzhaber and all of our local leaders. I just wanted to comment on this part of the discussion. Yes, I am leaving the committee, and one of the things that's been important for me on the committee, I've tried to be a voice for peer support and traditional health workers being on the committee. I've said is going to be on the committee. And I would support Dr. Hemming's comment about reaching out further especially for young people. A comment made at this forum this morning was young people are our future. The results of the election, what happened when young people get organized. And so getting young people in and also getting people with lived experience, people who have received care in our healthcare system of one form or another, and bringing their perspective in, and not just one, which is really kind of like tokenism, but several of them. So I would urge in subsequent recruitments that we really reach out and try to find people with lived experience. I know several who might be interested in this. And you can just call me when that time comes next year.
Absolutely. Absolutely. Okay, feel free to reach out with any questions. And we don't have a healthcare workforce meeting in December, but we'll definitely send you an email with the outcomes of that vote when this slate is presented. Thank you. Switching gears just a little, we also wanted to talk about an important part of the committee, which are officers that serve a 1-year term as chair and vice chair. And so please contact Ian. Anyone can run for these positions. You don't have to have been a committee member for any certain length of time. A big part of it is facilitating these meetings. There are 6 of those meetings a year, which the chair and vice chairs help to facilitate. And then another part of the role is that you meet with OHA staff and our Oregon Health Policy Board liaison about once a month about any committee business, going over meetings, educational webinars, things like that. And then I would say the third, maybe most exciting part of the role is that you get to help set the direction of the committee, which I think will be especially important in 2026 because we have 2 big deliverables that the committee will be working on. And also an exciting time because the Oregon Health Policy Board has picked primary care as one of our topic areas or one of their topic areas that they really want to focus on. And I know that they're having discussions with how to bring the Healthcare Workforce Committee to help play a larger role in moving that forward. So I think the chair and the vice chair can really help with setting the course for the committee next year. So we hope that you will step up and want to take on this role. We'll be having elections at our January 7th meeting. And please contact Ian or myself if you're interested. And I'm sure he would love to talk to you more about the role. Great. Next slide, please. Okay. Before we go on our break, I think we're running early this meeting. We really just wanted to, and actually, could we go back to the slide where we had the members that were leaving the committee? I don't know what number it was. Oh yeah, there we go. If any of the members, if any members want to say anything about that, we would love to hear from you. And I know, Rob, that you're attending an event, so if you'd like to say a few words, we would love to hear from you.
Yeah, I really appreciate the invite to come say a few words since I couldn't make this meeting. I was at a different international training this morning virtually where they were talking about the importance of people feeling like they matter, that what they do makes a difference. And that's really important when we're working with this. This is about young youth, young people, and trying to help them feel like they matter in our world. It's part of the comment that I was just making, that they have a voice and they matter, and what they say and do makes a difference. So that's what I felt when you asked me to be here, and I thought it would be important to step out and just, I've been on the committee for several years. I'm term limited out, I think, and it's been mostly a great experience. There's been moments of frustration and trying to work through some stuff, and that's part of the deal, I think. So I value the time, and I just wanted to be able to say that. And I'm going to say again that something that I've always looked for, and folks who've been on the committee for a while know this, I've looked for where's the voice of lived experience, where's the traditional health worker voice in our work. And I certainly hope that that carries forward, and the people who are joining the committee now or on the committee will help push that forward, because we have a lot to do. We're in a difficult situation in our nation, in our state. We're just talking about it here this morning in Ashland, and I think this committee can make a real big difference. So best of luck with everything you're doing, and I've sure valued it. I do appreciate the opportunity to come and say goodbye.
Great. Thank you so much, Bob. I don't think Dr. Chowdhury was able to join us today, but if there's any other committee members, either that are leaving the committee or not leaving the committee, that want to say a few words, please go ahead.
Deepti, I'll just say, I just want to thank all of these committee members who are departing. I know some of you started prior to the pandemic when we were still meeting in person and were with us during that incredibly disruptive time, and really appreciate all you've done for the committee throughout your years of service. And others are retiring and moving on to other pursuits, and just so grateful to all of you for your service, your contributions, and just want to appreciate you so much for that.
Wonderful. Thank you. Thank you so much. And I think I had let Jason know that if he, if you start to miss OHA too much and committee work too much, please let me know. And there are many committees, I think, under the Oregon Health Policy Board that would love to have your expertise. So I can provide more information about that if you miss us too much. Great. Thank you. Thank you very much. We will take a break, I think, until how about 10:30?
Hey, welcome back, everyone. We can give it just a couple more seconds to invite everyone to become situated. Okay, so hope everybody enjoyed their break. For our final presentation, we will be hearing from Neelam about the planning for the 2027 Healthcare Workforce Needs Assessment.
Thanks, Levi. I'm going to get us started, and then I will also hand it off to Deepti. So this is a follow-up discussion to a conversation we started during the September Healthcare Workforce Committee meeting around planning for the next iteration of the Healthcare Workforce Needs Assessment. Next slide, please. So just to provide you all with some background, I'm sure you're all very familiar with this, but just want to make sure that everyone has the same understanding that the Healthcare Workforce Needs Assessment is a legislatively required report per House Bill 3261, which was passed in 2017. This report is required to assess Oregon's healthcare workforce needs, and the report is due to the Oregon legislature every 2 years. The report must consider the workforce needed to address health disparities among medically underserved populations in Oregon, the workforce needs that result from continued expansion of health insurance coverage in Oregon, and the need for healthcare providers in rural communities. These 3 bullet points are taken from the legislation. And so this is our requirement in doing the needs assessment. The needs assessment is reviewed and approved by all of you here in the Healthcare Workforce Committee, as well as OHPB prior to submission to the legislature. This 2027 report will be the 6th report, and it's due to the legislature. In the legislation, it says no later than February 1st on the odd numbered years. So in 2027, that will be no later than February 1st, following the committee's approval and OHPB's approval. Next slide, please. So this slide has some information about the process we're proposing, as well as the timeline for the 2027 report. We shared at the last meeting that we are in the process of searching for a contractor, and we heard some preliminary feedback that you would like to see this contractor have broad healthcare workforce expertise that will work with the committee in order to start the process of developing this next needs assessment early next year, and with more committee involvement. We're seeking this time a single contractor to work on the needs assessment, as well as the evaluation of healthcare provider incentive programs, which is also required by House Bill 3261. This is the first time we're going to be seeking an external contractor for this evaluation. It was enthusiastically approved by OHPB at yesterday's administrative cost discussion. And OHPB leadership has expressed to OHA that they would like us to secure an external evaluator for this 2027 evaluation report. And then lastly, we will have the approval presentations of both reports by the committee no later than December of 2026, and by OHPB at their January 2027 meeting. So that way we can meet those legislative timelines to have the report submitted no later than February 1st. Next slide, please. So this is staff's recommendation is that we increase committee involvement in the 2027 report. And we had a preliminary conversation about this. And for those of you who are on that call, seem to enthusiastically agree that, in our search for the contractor, we will keep committee members involved throughout the report process. The first milestone will be to involve you in developing an annotated outline, as well as then throughout the report process, advising on the content. And the way in which we would do that is working in a few subcommittees related to selected needs assessment focus areas. These committee meetings, these subcommittees would meet regularly with support from OHA staff and the contractor, and would guide the report's development and also provide a feedback loop. And we also heard that from you that the preference is that these subcommittees should meet during committee meeting times in 2026. And then if additional meetings are required, we also heard from you that it's difficult for some of you to rearrange your schedules with short notice. So we will try to schedule as early as possible to allow for scheduling if additional meetings are required. Next slide, please. So I'll pass it to Deepthi.
Great, thank you, Neelam. So I'm just going to be talking a little bit about the feedback that we have gotten to date. And so we asked to provide information about areas of past reports that have gone well and areas that could be improved on, and also priorities that should be included in the next needs assessment. And so the slides coming up incorporate that committee feedback that we received from our last committee meeting back in September, and then also from a survey that was sent out in October. And thank you very much for the committee members that took the time to complete that survey. If you didn't get a chance to, it's still open, and we would still love to get your feedback. Next slide, please. Great, so this is the committee feedback that we heard from you. The first theme was that we should include contextual information, and that the needs assessment should try to have a narrower scope. We did hear from some members that they liked parts of the scope being so broad, because when we talk about workforce, it really is, a very broad topic. but we also heard from others that a more concise report might have more impact and more meaning. We heard from a couple of people that, you know, the last report was over 150 pages, and not a lot of people have bandwidth to go through that length of a report. And so going back to some previous reports, you know, they ranged anywhere from as short as 10 to 30 pages. This one was on the longer side at above 150. So if we can have a more concise report, we heard that feedback. We also heard that we should include information about the changing healthcare landscapes, given that there's so many things going on in the world and in Oregon and at the federal level. There are definitely some big changes coming in 2026, and that the needs assessment should incorporate that as much as the timeline allows. We also heard that it would be great to have committee members that are involved in the report's design, and we'll do that primarily through the subcommittee work that Neelam had talked about. We also heard that there should be fewer focus areas, with each focus area going deeper into the topic for each one. So one of these focus areas will be primary care, to align with the board's priority areas for 2026 to 2030. But there's room and space for discussion to talk about what those other focus areas will be for the report. We also heard that the needs assessment should prioritize the top workforce issues in Oregon, and that committee members in the subcommittee meetings could really help to identify what those top workforce issues are. And so both the report and the recommendations should really prioritize those top issues. Next slide, please. We also heard from the committee that we should include more information on developing equitable healthcare career pathways. We heard feedback that the data, it was great that we included data on both the licensed and certified healthcare professional workforce, and that we should continue to do that. There are some data limitations that exist for the certified workforce. And so we should work to incorporate that data as much as feasible, much as possible. We also heard that we should include data on healthcare education programs to understand the capacity, the attrition, and the retention as it exists in Oregon, and to expand our section on that. We also heard that the needs assessment should specifically identify barriers that people are experiencing in healthcare education and credentialing, to develop approaches that address workforce shortages and diversity, such as providing stackable credentials and giving credit to prior experience and learning that an individual might have. Next slide, please. We also heard a lot about recommendations. The past needs assessment had over 40 recommendations. So we heard feedback that fewer recommendations, but also ones that were more actionable, should be focused on for the needs assessment. And we also heard that they should have status updates. So the recommendations should be more specific, and they should continue to be evidence-based. We also heard that while recommendations are great, we should also hear about potential barriers that might exist to enacting recommendations, when those barriers can be spelled out, or when they're known. We heard that recommendations should focus on both systemic barriers, but also on more of the level of a clinician level, and the changes as well. We heard that maybe 40 plus recommendations are too many, and having fewer recommendations might help each recommendation to get more attention and make progress, and for it to be prioritized higher. And we also heard that it would be great to include information on the status of past recommendations that have been put forward and a status on what, if anything, has happened with those recommendations, and that could be included in the needs assessment, even if it was, something like a table or a narrative, but to have something about status of past recommendations. Um, People also suggested that a good way to prioritize recommendations in the report might be to identify the ones that would be the most actionable in the next few years. That is what we heard from those two forums, from committee members. We also wanted to leave time for both committee members that we haven't heard from, or people that have already provided feedback but just wanted to bring up their feedback in this forum, and then we can talk about it more. With that, I wanted to open it up for any additional feedback that committee members might have.
Hi, this is Molly Reynolds. I'm just going to jump in and just to emphasize the point that you just made, that I think it's really important that we understand the impact that our work is having on policy. And I think that knowing that our work and our efforts is actually having an impact and actually making a difference can really help with buy-in within the committee and from the outside world as well. So just knowing that we have any kind of impact is, I think, just really important for buy-in, and I wanted to emphasize that. Thank you.
Thank you, Molly.
I was just going to say, it's Rob here. As usual, I'll jump in. But on the first slide, one of the assumptions that the healthcare insurance coverage is going to expand, I think it should be the direct opposite, because it's not going to expand in the next, who knows, 3 or 4 years, I suspect, because the funding is disappearing, and we're going to have to deal with an influx of probably a massive number of uncovered, uninsured patients. So I think we need to keep that in mind.
Jordan, could we go back to that background slide? I think it was the first content slide on this one.
And I can also say that, this is taken straight from the legislation,
Yeah,
and
I know.
the legislation was written at a time, when we were looking at significant coverage expansions, and I think that's why we had heard from you all that setting that context for where we're at right now is really important.
Yeah, I just want to bring that up because it isn't going to expand. We can see it starting now, but it's going to be very dramatic come January 2027, I believe.
Thank you, Rob.
Yeah, this is Eric. I want to echo something that you said in there about the length of the report, and finding maybe a new contractor to do this. I think both the format, content, and messaging needs to be consistent. And one of the reasons why I say that is that, I think it's important to know where the workforce status needs to be on a routine basis every 2 years. But really, it's like I use this analogy a lot when we're talking about healthcare workforce development. It's like forestry research. The forest we're planting today is the workforce we get a decade, 2 decades from now in some of the fields. And so if we don't remain consistent, then we won't see the fruits of any of this labor, or we can't interpret it. And back to Molly's point about knowing that we have impact on the work that we're volunteering to do, that's important work. Like I think both echoing that we should see what policies have been enacted and what are the outcomes of it, but we can't also visualize the outcomes of it if our format keeps changing rapidly because you're not it's the policy we enact today isn't going to really see a benefit until like 5, 10 years from now.
Thank you for those comments. Those are well taken. Thank you.
The, the other things I know from lobbying, if you want to get something done legislatively, whether it's through feedback through the OHA or whatever, it's really important to try and keep the main points of your conclusions from any study to a page. So, personally, I think the report can be longer, but we need to figure out how to summarize it in a page or at most a page and a half. Somehow.
Do any additional committee members have any feedback they want to provide?
I know that the focus on rural throughout the last healthcare workforce needs assessment was present in every single section, but I feel like it would be nice to have a specific section that focuses on the unique challenges that we're having currently in rural areas related to healthcare workforce.
Great, thank you for that feedback. Well, if nobody has any additional feedback at this time, I think we can end this part of the meeting. But I did want to mention that this will be an ongoing process, and so if something occurs to you later, to please let us know. We'll be having discussions with potential contractors. In the next few weeks. And so I think any additional feedback is always welcome, and we can work on incorporating that. Yes, go ahead, Rob.
So the one thing I was going to say too is that probably a few of us have. I don't know who you're considering for contracting with, but I suspect a few of us in our decades of working in healthcare have maybe worked with some of these and could give some feedback if you have specific organizations in mind to do the contracting.
Thank you. We'll keep that in mind. Neelam, did you have anything additional anything that you'd like to add before we wrap up this part?
No, just, I wanted to welcome if anyone has any suggestions for contractors we should be looking into or approaching. that we would welcome that.
Great. Then I'll turn it back over to you, Levi, to wrap us up.
Thank you. Sounds great. The wanted to just give a special thanks to a great report and highlighting the information for us, and wanted to thank everyone who led the discussions and shared their thoughts today as we worked alongside one another. On the next slide, we just are highlighting that the next meeting is January 7th from 10:30 to 12:30 Pacific time, and we look forward to having everyone there.
I was just going to mention this is our last meeting of the year, but we'll be in touch over email about any committee business that comes up, or what happens with that membership slate, or other things as they come up. But this is our last meeting of the year, and so I don't want to run through all the holidays, but I hope everyone has a great rest of your year. And we'll see you in January. And I just wanted to mention that the meeting is shortened in January to allow space for the new member orientation. That will hopefully be happening that same morning. Yeah.
Also, there is a question that just arrived in the chat.
We're you know, exploring different methods to identify a contractor right now with our budget and contract teams. And we're really looking for a contractor that has workforce expertise based on your feedback, broad workforce expertise.
All righty. Thank you, everyone.
Okay, thank you.
Thank you, everyone.
Happy holidays of
you.
them all. Kwanzaa, Hanukkah, you know, the list.
Thank you.
Thank you.